The present and previous governments have continually underinvested in disability services, and this is evidenced by the level of unmet need across disability services, which was highlighted in the Disability Capacity Review published in July of 2021. Now, the purpose of this review was to estimate the scale of current outstanding need for specialist disability services and how the scale and shape of need is likely to evolve over the years up to 2032. Now, the review was a sensible and prudent undertaking, as we need to know the challenges that are in front of us if we are to have a disability service that can deliver the social supports needed to enable people with disabilities live truly independent lives. But the review's findings are stark, and that to address unmet need alongside demographic change would require current disability spending in 2032 to rise by £550 million to £1 billion above its 2018 level to deliver the capacity required. As well as this, additional capital spending for housing to complete the closure of residential institutions would cost in the region of £500 to £800 million over the period to 2032. So with these figures in black and white, the Government in Budget 2023 has once again failed to resource and fund disability support services appropriately. So this is the second budget since the capacity review was published, so two opportunities have been missed. The Government have not even published a plan to implement the recommendations of the capacity review, although it has initially committed to do so by December 2021. This implementation plan must be published without delay. The Minister has recently stated it was already being completed, so I'm just asking why has it not been published before the budget so its recommendations could have been acted on. Now, Sinn Féin has outlined a funded strategy to meet the needs of people with disabilities out to 2032 in our alternative budget this year, and we would have invested £153 million additional in disability services compared with the Government's dismal £29 million. In relation to CDNTs, my constituency office is contacted on a weekly basis by parents whose children have been on a waiting list for an assessment of need for anywhere between 2 to 4 years. There are approximately 17,000 children waiting for initial contact with a disability network team, and 2,500 children whose assessment of need are overdue. In fact, the total extent of waiting lists for disability services is currently unknown due to poor data systems. Underinvestment in IT infrastructure is holding the entire health service, including disability services, back. The staff working in CDNTs are under immense pressure to deliver interventions and assessments, all while there is a vacancy rate of approximately 28% across these teams. That's almost a third of their workforce not in place. So how are they expected to deliver interventions and assessments in this situation? The backfilling of therapists who are on maternity or paternity leave is not funded, and this makes up a significant proportion of the vacancy rate. So why has this not been addressed? The Government simply does not have a plan to deal with this. They have not dealt with the problem of professional progression within CDNTs, and the staff are leaving to go to primary care or to the private sector. Disparity exists between HSE and non-HSE workers who are all working together and carrying out the exact same job. The Government needs to publish a costed multi-annual plan to deal with waiting lists and staffing problems in disability services without any further delay. Now, in response to a parliamentary question I submitted regarding the number of additional therapy courses that are being introduced for this academic year, where the HSE has identified a significant skills shortage, such as speech and language therapy, occupational therapy and physiotherapy, I was informed that an additional 15 physiotherapy places were to be made available, 9 at level 7 and 6 at level 6. There was no indication in the response that any additional places were made available for speech and language therapy or occupational therapy, even though the Minister in the response stated that, and I quote, "The matter of health workforce planning and ensuring an appropriate pipeline of qualified healthcare workers within Ireland is a major priority for my department." So really, is 15 additional posts the extent of what this Government states is considered a priority? So I'm hoping that the information in the PQ is somehow incorrect. The Government badly needs to address workforce challenges with a serious workforce planning group led by the Taoiseach to include health and higher education. So while I cautiously welcome the indication from An Taoiseach that there will be a new policy approach, it cannot be used to dilute the rights of people with disabilities in the Disability Act. We have already seen this Government try this approach and make the situation even worse. The Government must adopt a rights-based approach to disability services in line with the UN CRPD. They need to publish a costed, multi-annual plan to deal with waiting lists and staffing problems in disability services. And finally, and also crucially, they need to ratify the optional protocol to the United Nations Convention on the Rights of Persons with Disabilities. Thank you, Chairperson.